I'm Dr. David Hill, and today we're going to be talking about ear drainage in infants. Now, drainage, of course, is anything that comes out of an infant's ear. The question is, what is coming out of the ear? The most common thing to come out of an ear is wax. Now, earwax has a variety of textures. Sometimes it's orange and gummy or almost fluid seeming. Sometimes it's kind of flaky and yellowish. There's actually a gene that's been identified that determines how moist or dry different people's earwax is. Earwax is supposed to come out of ears, and you don't need to do a darn thing about it. Here's what you really don't need to do. Don't put a Q-tip or anything that looks like a Q-tip in the ear. The wonderful things about ears is that they're able to clean themselves. They have cilia that move the earwax. They're the cilia, by the way, little hairs, little tiny microscopic hairs. They actually move wax out of the ears and clean the ears out themselves. So if we just leave the ears alone and clean the outside of the ear with a washcloth, the inside of the ear is going to take care of itself. You start jamming stuff in that ear, what you do is you pack the wax back in. It's trying to get out, and you're putting it back in. Don't do that. Now, what if there is fluid or pus coming out of the ear? That's a different matter altogether. That suggests that there's an ear infection, often an infection of the middle ear, the part where the little bitty bones are, that has caused a rupture of the eardrum, and now that infection is draining. That's almost certainly something that your doctor is going to want to treat with antibiotics. Sometimes they use antibiotic drops, sometimes they use antibiotics that the baby takes by mouth, sometimes they use both. But the doctor really needs to get a look in there and see what's going on in that ear, see if there's an infection, if there's a hole, and figure out what the best treatment is going to be. Talking about drainage from infants' ears, I'm Dr. David Hill.